Another heartbreaking challenge our communities are facing right now, suicide. According to the Colorado Department of Public Health and Environment, suicide is the second leading cause of death among 10 to 20-year-olds in Denver and in the state. And for Rick Padilla, this is personal. His 15-year-old son, Jack, died by suicide earlier this year, and he is joining us right now. Thank you. And first and foremost, our condolences. What a terrible loss. And I know you go out and you talk to people about Jack. Tell us a little bit about him.
Oh, absolutely. Jack was a 10-year lacrosse player, a goalie, started when he was 5. Very compassionate, empathetic young man. Always gave before himself. And Jack attempted suicide on February 4th. He struggled for 9 days. On February 14th of this year, we lost Jack. Since that time, I have taken on the role of really bringing awareness to mental health, suicide, and the stigma surrounding it.
And why is it that you think we've gotten to this point? I mean, these are pretty staggering statistics. Denver's had 108 deaths by suicide. That's just this year.
I think there's a lot of factors that go into it. For youth, that's a cohort group that I'm focused on right now. I think you look at back when I was growing up, if a child was bullied at school, at the end of the day you got on the bus, you went home, it was over until the next day. I think social media is a contributing factor. I think the stresses kids are facing in school today, the demands on having to achieve a high achiever, great grades, getting into college starts early on.
And for you, I know you said Jack dealt with some depression.
Yes. And
also dealt with bullying. What are the signs that any of us can be looking out for or seeing, and what maybe did you not see?
Sure. You know, I think it's one of the things that with adolescents, what we think are typical adolescent behaviors may not be that. In isolation, for example, in their rooms all the time, not coming to dinner, perhaps changing friend groups. These are all warning signs. And then you start to see some suicide ideations that start to come into play. And so we as parents, we start to look at these warning signs, these risk factors. Vaping's a risk factor. Drugs are a risk factor. Alcohol is a risk factor. There's lots of risk factors in there, including mental health and depression. And
so many of those things, I think as a society, we all struggle with that because with some variation of these issues, right? I mean,
right.
And especially for our kids when you don't really know what's going on with them. So how do we get that conversation out there then?
I think what I decided early on, my family and I decided early on that I understand the grieving process. We're going through that now for our son. But in order to really make a real impact, you have to share your story. And we've been willing to step up and share our story because it's a conversation that parents need to have with their kids. Kids want to know that we're listening. Kids want to know that we care. Kids want to know that we love them.
So I know that you have stepped up as the Suicide Prevention Administrator for the Denver Department of Public Health and Environment. What does that mean? What will you be doing?
I think the city of Denver's realized it's the largest jurisdiction in the state. We have to help lead this effort. And as a part of that, we're really looking at not only the statistics, but what are our partners doing at the state level? What are our partners doing in the healthcare industry? What are our schools doing around this? And my charge is to start to lead a collaboration to bring these stakeholders at the table and start to figure out some strategies across the board, because it's not any one entity. This is a community issue.
Because I think so many people focus on schools and why schools aren't doing enough, but your point is there's so many other aspects that come into play, right?
There really are, and we have to collaborate with one another. I think we have to move past the discussion of pointing fingers and really move towards the discussion of this is a real issue in our community. The stigma attached to mental health, it's okay to not be okay. It's okay. And our kids talk about it. We as adults don't seem to have that conversation with our kids, but we need to.
And there was a new law passed here in Colorado this year that would allow young people to seek mental health care without parent permission.
No, absolutely. It's House Bill 191120. 3 weeks after Jack passed, I went down. They had closed public comment, but they were kind enough to allow myself, my older son John, one of Jack's best friends, and Maria Bales to testify on the bill. And I think and I believe that helped push it through. And it's one that when a kid's in crisis, you can't just send them home with a piece of paper to get permission from your parents to talk to a therapist. There's that moment in time when they're in crisis where they need help. And they ought to be able to talk to a licensed professional to get them past that crisis point.
Yeah, because sometimes they don't want to talk to their parents or to their friends, right?
That's exactly right. In that intervention is critical. And if the therapist identifies that there's some suicide ideations there, he or she has the obligation to then notify the parents, but it's up to 3 visits. And really what we've learned with the passing of Jack is there were those critical moments that I wished somebody would intervene when we weren't available.
Well, again, our condolences. I'm so sorry about your loss of Jack, and thank you for spreading this information that really it is okay to be hurting out there and find somebody to talk to about this. So thank you, Rick, so much.
Thank you very much.
I wish you well, and your family as well. And as we head to break here, please know there is help out there. If you are thinking of harming yourself, you need someone to talk to, do not hesitate to call the National Suicide Prevention Hotline, and that number is 1-800-273-TALK. And no matter when you call, there will always be someone there to pick up the phone.